After watching the video, you should have a better understanding of hands-only CPR. It's important to note that anybody can do it. There is no formal training necessary. The 2 steps to save a life are call 911 and push hard and fast in the center of the chest. If there is an unconscious adult or child, you're looking at doing compressions to 100 and 120 beats per minute, right to the beat of staying alive, as mentioned in the earlier video. Your arms are locked under your shoulders, and you're using your body weight, and your fingers are interlocked in order to continue compressions. Do not lift your hands off the chest, and you're going to find the center of the chest between the nipple line and the xiphoid process. Snap, crackle, pop, that's okay. Ribs may break or crack. You may also break the xiphoid process. These are all normal and minor when you look at the idea that you're saving a life. An unconscious infant. How do you know the difference between an infant and a child? An infant is going to be under 2 years of age, and a child is going to be over 2 years. Now, it's hard to know the exact age, so please go by size as necessary because it's not like you're going to be able to have that information when giving care. Your 2 fingers, not 2 hands, 2 fingers are in the center of the chest at this point. Do not lift the fingers off the baby's chest, and you're going to the same beat of staying alive as you did with an adult or a child when giving care. When can you stop? An AED arrives, medical professionals arrive, the scene becomes unsafe, or the victim is showing signs of life. What is an AED? It's an automated external defibrillator. The pictures below show you what an AED looks like. The other is a sign that would show you that an AED is around. There are many around our school. There are also some in very public places as well. What do? You open up the AED and you follow the directions. Yes, it really is that simple. You turn the AED on, you remove the pads and place them on the victim. The pictures will show you exactly where the pads go. The victim must be dry. You may need to remove a bra, hair in the chest, or remove any medical patches. There will be gloves and a razor in the AED machine to help you. Listen to the instructions, and if no shock is advised, you are to continue your compressions. Leave the pads on the victim. The AED analyzes every 2 minutes. And it's important to note that every minute that defibrillation is delayed reduces the risk or chance of survival by 10%. Bystander intervention is key. It's really important to make sure that you act. The Good Samaritan law protects you against any medical emergency from being liable from injury or death caused by the victim during a medical emergency. What does that mean? That you can give care without needing help. Survival rate increases to 40% if the bystander provides CPR and uses the AED before medical professionals arrive. Oh, I almost made it.